Hi, I'm Jocelyn Strand. I'm a naturopathic doctor and the director of clinical education at Biocidin. And I'm really excited to be here today to talk to you about an aspect of detoxification that not everyone thinks about, which is what's happening in the microbiome or what's growing in the gut. One of the foundational therapeutics in functional medicine is the supporting of detoxification for ourselves and our patients. But when we think of toxicity, endogenous, and that means internally produced toxins, don't necessarily spring into our mind. The microbiome is a source of metabolites and inflammatory mediators that can either support health and detoxification or contribute to toxic load and disease. And we're going to talk a lot about that today. And we're going to talk specifically about the liver-gut axis or the gut-liver axis, which anytime you talk about an axis, you're talking about a bi-directional pathway, which means liver function influences what's growing in the gut, and what's growing in the gut influences liver health. And we're going to go into great detail on that and the reasons why that is. For me as a clinician, this explained why I saw a better clinical outcome for patients when we worked the microbiome while we were doing detoxification. If someone has dysbiosis and is producing a lot of toxins internally, you're not going to see the same clinical outcome as you would if you worked on a microbiome reset at the same time. And I'm here to tell you that I saw that bear itself out in clinical practice, and really hope to share with you this protocol that's very easy to use, and what I saw was highly clinically effective for me. Before we get started, the FDA has not evaluated the statements or claims in this presentation. You'll hear me talk about my clinical experience. That is not a claim by the company. We do have some research under our belts, and I will certainly tell you about that today, and I will qualify that when I tell you. Other than that, it's just either a pilot research, a case study, or my own clinical observations that you'll hear me talking about today. Let's first sort of set the stage by talking about environmental determinants of chronic disease. So there's a big debate, nature versus nurture. I even heard about it in high school and in college. And what we have found in the study of epigenetics, and epigenetics being describing the effect of environmental factors on the behavior of genes. And I think that feels sort of abstract and esoteric. And the way that I would think about it is the behavior of your genes determines which hormones are you secreting. How much inflammation are you making? Do you have good methylation status? Is your immune system functioning well? All of these are determined by the behavior on the cellular level of your genes. And the behavior on the cellular level of your genes is determined upon the environment around those genes, toxic load, other microorganisms. So there are many things that determine the environment, lifestyle choices, sleep, stress, all of these things influence our genetic behavior. And what it means is that that's a place where we can really create change and healing effect in our body. So I really like this article. It was written by Margaret Sears and Stephen Genius. And I love the way that they articulate in the lower right-hand corner, genetics loads the gun and the environment pulls the trigger. So it just speaks to that, the effect of epigenetics, and that toxins are play a major role there. Genetics may predispose individuals to chronic disease, but this cannot account for rapidly increasing prevalence within a generation or two. This leaves us with pervasive environmental factors. So why is this important? What it means is that diseases that we see blossoming at a high rate, so chronic illnesses, they cannot be explained away by genetics. It means that there's an environmental trigger that's changed, and that can be any number of environmental triggers, but our toxic load exposures in the environment today are so profound that it's a common sense or sensible place for us to look for ourselves and for our patients as well. So what are environmental contributors to chronic disease? Toxic elements, naturally occurring substances, pesticides, POPs or persistent organic pollutants, volatile organic compounds, and plastics. Toxic elements I think of as heavy metals, right? So we think mercury, arsenic, cadmium, and lead. Those are sort of the most common ones that we think about. And then mechanisms of toxicity and disease. So then what happens, right? We get a toxic load, it increases oxidative stress, it can cause endocrine disruption. So that's hormone disruption. And I think, we think of things like, estrogen and testosterone as hormones, but also bear in mind that that includes things like pituitary hormones and also adrenal hormones, which is your ability to manage stress, insulin and glucagon. These are hormones, all of them influence blood sugar. And so there's a wide array of, when we talk about endocrine disruption, we're not just talking about sex hormones, we're talking about very, very delicate balance in the body of governing our hormones that, and the profound effect that you'll see as a result of that. Genotoxicity, so again, altering the genetic function. Enzyme inhibition, we'll talk a little bit more about that in the coming slides. And dysbiosis. So what is dysbiosis? Dysbiosis is unbalanced growth of the flora or the bacteria, fungal and viral elements. In the gut is our primary reservoir, but we do have microbiome, so dysbiosis happens in the microbiome. We have a microbiome, which are all of those things and their genes. So all of those microorganisms and their genes, and we have them all over the surface of our body, and the largest reservoir in the gut. So they're in our sinuses, our ears, our mouth, our lungs, our genitourinary tract as well. So all of these areas can have dysbiosis. Let's talk a little more in depth about the microbiome and the role of the microbiome in toxicity. So the microbiome, if we have a healthy, balanced microbiome, it serves us as the host. So you'll hear me talk about the host health. And when I say host health, I'm talking about our human body. So a healthy microbiome benefits the host by helping with hydration. We know vitally important for detoxification is to have adequate hydration, nutrient synthesis. So things like CoQ10, vitamin B6, these are produced, vitamin K are produced by microorganisms in the gastrointestinal tract. We think of control of epithelial cell proliferation, so the ability of the gastrointestinal lining to heal itself and also to proliferate correctly, so that we have, when we get to that differentiation, right, where it completes its pathway to a cell, that it's done so in a healthy way, which can help with prevention of cancer. Training of the immune system. So this is vitally important. When we have a healthy microbiome, it helps us to identify the enemy versus friend or foe. So is this part of the human body? Is it something I need to react to, like a pathogen? So is this a harmful microorganism? Is it a food that I should react to, that I shouldn't react to? Is it bee venom that I should or shouldn't react to? And so or is it a pathogen or a harmful organism that I need to react to? And all of this priming, immune priming is what it's called, is dependent upon having a healthy microbiome. Also immune reserves for systemic defenses. So again, if we're trying to stay healthy upon exposure to a harmful organism, having a healthy microbiome is of vital importance. And then finally, production of short chain fatty acids. So that's what SCFAs are. And let's talk about those in a little more depth, because they're one of the main mechanisms by which a healthy microbiome helps with stabilizing or having a healthy environment in the body. So short chain fatty acids are produced by beneficial microorganisms in a number of different, or requires a number of different things. Good enzymatic function. So an enzyme will take a molecule and the enzyme then acts on the molecule to change it into a different molecule. And what you'll see here is a precursor for a short chain fatty acid, which comes in some of the prebiotic foods. And I guess what I'll talk about then is the end product is butyrate, acetate, propionate. Those are all short chain fatty acids that are well known. Butyrate in particular has a lot of potent anti-inflammatory effects in the body and is very important. The key mediators for communication between host and gut microbes. So these short chain fatty acids also play a role in the communication between the host and the microorganisms. The metabolites produced by microbes can influence host immunity and metabolism. It also does something called promoting T regulatory cell function. And that a T regulatory cell is one that down regulates, it's like the brakes, right? So we have the gas that's pro-inflammatory and we have the brakes. We need both of those things. A healthy microbiome through short chain fatty acid production and host communication will help create balance and the brakes on the inflammatory pathways in the body. They also affect gut integrity by decreasing the luminal pH. So they alter the pH in the gut. Microorganisms in the small intestine then can't grow as well. And we don't want a whole lot of microorganisms in the small intestine. I'm going to wager, as people who are familiar with Siobhan, that you already know we don't want a lot of those small intestinal bacterial overgrowth, or the growth of those organisms there. Also exerting beneficial effects against intestinal inflammation, so reducing inflammation in the lining of the gut itself. So really important for us to have those adequate levels. And this is where you see a lot of prebiotic supplements, but there are other ways that we can support the production of short chain fatty acids, and we'll talk about that shortly. So one of the metabolites, we have the good, and then we have the bad. And lipopolysaccharides, or LPS, are pro-inflammatory. It's a pro-inflammatory metabolite that's produced by gram-negative bacteria in the microbiome, in the gastrointestinal tract, in the mouth, and elsewhere in the body. In fact, if there's an infection at a distal site, say someone gets a cut on their leg and it gets infected, a gram-negative bacteria will release this lipopolysaccharide directly into the bloodstream, and it's the cause of septic shock. Injection of just a few nanograms of LPS will cause symptoms of septic shock. That's how toxic it is to us. So lipopolysaccharide, chief endotoxin that's produced by our microbiome, and it's related to, or I guess what's the right word? It's associated with a number of different autoimmune conditions, or excuse me, diseases, including autoimmune diseases, inflammation, cardiovascular disease, deposition of amyloid plaque, which is responsible for Alzheimer's disease and other dementias. And it also, as it circulates through the body, it damages what's called the blood-brain barrier, which is a very delicate yet powerful, right? And you'll see that if you look at an image of the blood-brain barrier, it keeps out bad molecules, pathogens when it's healthy. When there's inflammation in the bloodstream, it can cause damage to that. And then you get leakage, leaky brain, right? Similar to leaky gut, where leakage of the inflammatory molecules and even pathogens into the brain can occur. And then that can contribute downstream to neurological disease as well. So lipopolysaccharides and the liver. The liver is our final barrier. When we eat, when we have the microbiome in the gut, the blood flow, similar to the blood-brain barrier, is a very thin layer between what's going on in the gastrointestinal tract and the bloodstream. And if what happens there is absorption directly into the bloodstream that surrounds, just beautifully surrounds all of the gastrointestinal tract to pull all of the nutrients out of our food and out of our stool. And all of that goes first pass to the liver. So all of it goes directly to the liver. The liver identifies what is dangerous, what needs to be cleared, and then the rest goes out to the rest of the body. So the liver is our final barrier to prevent that lipopolysaccharide and gut bacteria from entering our systemic blood flow. So from entering the rest of the body, which is why, an infection out in your arm or your leg is much more dangerous than an infection that's isolated in the gastrointestinal tract, because we want it to go first to the liver, which clears it. So the downside of this is that the liver, through Kupffer cells, which are immune cells in our liver, will clear almost on the first pass the vast majority of the lipopolysaccharides, and that causes damage to the immune cells there. And it also causes collateral damage to the surrounding order called hepatocytes. Those hepatocytes are cells in the liver that are responsible for the production of bile, right? And for the conjugation and detoxification of all of the molecules that are circulating in our body and things we get exposed to from our gastrointestinal tract. So you can imagine that if you have a lot of LPS, damage to the Kupffer cells, damage to the hepatocytes, and again, increasing total toxic load. So this is of vital importance if you're trying to do a cleanse or help your patients cleanse, that you pay attention to the amount of lipopolysaccharides and other inflammatory metabolites that may be being produced by the microbiome. So how important is it that we pay attention to this? Well, there are animal studies that show that LPS is cleared within just minutes, and that most of it goes directly to the liver. So in a mouse study, I'm going to see if I have to think about this for just a second. There was a mouse study with this, and they had a sterile gut, which means there are no microorganisms in the gut. When they introduced LPS into mice that had no microorganisms in their gut, the LPS didn't cause the same level of damage to the liver. So really, really fascinating. So That's one. And then the other is alcoholic liver disease. Rats that were fed ethanol only develop fatty liver until you introduce LPS, and then it causes death to the liver cells. So really interesting that it seems to be augment or play a role in the level of danger when we are associated, or that's associated with other toxins. So really fascinating, this damage and the importance of the level of importance for reducing the LPS where you can. And a little LPS is not a problem. It's when it starts to rise that it becomes a problem. So it's just an easy therapeutic for us, a place to reduce potentially chronic inflammation. So LPS metabolized in the liver, just another slide talking about that. This is from a research article. Says LPS in the bloodstream normally arises from the gut or from sites of infection. The liver rapidly clears circulating LPS, and both the Kupffer cells and the sinusoidal endothelial cells in the liver have a high scavenger receptor activity. The reason that's important is because the immune system is what's responsible for the release of inflammatory mediators, which means increased inflammation with exposure to LPS. So this is a picture of histology. Histology means the study of tissue. And you can see here that this is before LPS. So these are healthy liver cells. And you can see that there's some order to it, ligaments, and that they're well organized. After exposure to LPS, you can see a breakdown of the organization and then a total dismantling of the cell or disorganization of the cell. So clearly, actually, LPS is so toxic to liver cells and damaging to liver cells, they use it in research to cause damage to liver cells. So kind of important. I'm going to linger on this slide for just a little bit to talk about this bidirectional gut-liver axis. This particular article was on PSC, which is primary sclerosing cholangitis. But the reason I pulled this article and this image is because it talks specifically about the relationship between the liver and the microbiome. So the GI microbiome and bile acid metabolism are linked. There's a very tight balance maintained by the microbial ecosystem and the mucosal immune system, involving cell-to-cell signaling and the release of antimicrobial peptides to control adjacent bacteria. So in sort of easier languages, when we have good bile acid function, when we're releasing adequate levels of bile acids, it actually is antimicrobial, killing a lot of the microorganisms in the gastrointestinal tract by breaking down the cell wall. Those bile acids are called primary bile acids when they're released. When we have a pathogenic flora in the gastrointestinal tract, or it's out of balance, those primary bile acids will be converted at a higher volume to secondary bile acids. And those secondary bile acids are very highly toxic. So the way that they're toxic is increasing inflammation, cholestasis, which means slowing the flow of bile, gallstone formation, and even carcinogenesis, so the development of cancer, will happen when we have elevated levels of secondary bile acids. Alterations in bile acid homeostasis, so the balance, again, can lead to excessive intrahepatic accumulation of potentially toxic bile acids. So that means in the liver, accumulation of the toxic bile acids, and that this can play a role in mediating injury to the liver itself. So the two-way street, we have the liver releasing bile acids. If it's a healthy, it's going to be releasing bile acids in response to a meal, and that will help to suppress the growth of the pathogens and the other flora in the gastrointestinal tract so that we don't get overgrowth in the small intestine. And then those microorganisms play their own role by modifying the bile salts, and then that creates a feedback to the liver itself and potential damage to the liver or supporting healthy liver function. So really interesting, that two-way street. This is research showing that systematic review of and meta-analysis of prevalence of small intestinal bacterial overgrowth, so SIBO, in chronic liver disease. SIBO is significantly more frequent in chronic liver disease patients as compared with controls. The association of SIBO and chronic liver disease was not confined to patients with chronic liver disease, suggesting that SIBO is not a consequence of advanced liver disease, but instead plays a role in the progression of chronic liver disease. So speaking to that gut-liver axis. So the findings on this research were that both intestinal permeability and the prevalence of SIBO are increased in patients with non-alcoholic fatty liver disease, which we know is epidemic in this country right now, and that it correlates with the severity of steatosis. So again, the level of fat in the liver as well. So quick review, how do microorganisms contribute to potentially to toxic load? Through lipopolysaccharides and other inflammatory metabolites, inflammatory damage to the liver cells that are responsible for detoxification, interruption of the gut-liver axis, and loss of protection from short-chain fatty acids. So if we have imbalances, all of these things can occur. So there's another aspect to think about here, which are biofilms. Many of these organisms can produce biofilms. In fact, 80% of organisms, after 2 weeks, pathogens will have created a biofilm. A biofilm is an extracellular matrix, and it's very, very sticky. And I think of it like an invisibility cloak. So let's use Candida as an example, which is a fungal or a yeast element, right? So yeast, if one is floating around and it's releasing these signaling molecules is what it's called, and it's looking, basically it's looking for friends, and it's detecting from the environment, are there other yeast in the area? When they start to develop, and it's usually more than 20 cells in the surrounding area, then they decide this is a good spot for us to set up camp and to create a biofilm. And the purpose, there are a number of reasons this happens. It happens in response to adverse environmental triggers. And it's because they're trying to protect themselves. It's also a place where they can reseed themselves. So where it's free floating, they're much more vulnerable. Underneath a biofilm, they're much harder to kill. And underneath a biofilm, bacteria and yeast can resist up to 1,000 times the antibiotic concentration that would normally be needed to resolve infection. So it's basically a brilliant way for them to protect themselves. It's really important when you are working with therapeutics that break down biofilms to understand a biofilm and the implications of breaking down a biofilm, because if you think, so I use the yeast as an example, but it's vitally important that you realize that more than one organism is going to be underneath the biofilm, and the immune system may not even be aware of that microorganism that's under the biofilm. Not only that, but these biofilms are full of toxins, which is what we're going to talk about here shortly. And the outcome clinically is that you will start to see people react poorly when you introduce biofilm busting therapeutics, because their body's having to process everything that was underneath that, right? So all of these endogenous or internally produced or housed toxins are being cleared, and there are ways to support that, and that's a binder, and we will talk about that as well. So here are the different stages of biofilm development: attachment, adhesion. So even before attachment is quorum sensing. That's when they're talking to one another. Do we have enough to justify a biofilm? Attachment means adherence to the surrounding tissue. We'll say a tooth, right? Tooth is a common place for us to develop biofilms because it's a non-shedding surface. So the microorganisms can go into the pit of a tooth where we can't quite reach it with a toothbrush bristle and attach itself there. And then adhesion, they aggregate there, it grows and matures, and it detaches. And the other reason it's important to understand these phases is because therapeutics can be directed. There are a number of different botanicals and even pharmaceuticals that can be directed at these different stages that can help with biofilms. So again, we talked about this a little bit already. The advantages of biofilms over planktonic bacteria are protection from environmental fluctuations. They do increase their cell-to-cell interactions as well. So once they're inside a biofilm together, they exchange DNA, they exchange information. It's pretty fascinating. And this is where sometimes they can exchange resistance genes for resistance and all of that sort of, again, sort of pro-evolutionary and protective DNA structures. EPS is, the EPS matrix is too large to be phagocytized, which means that our immune system can't get at it, right? So it protects from host defense as well. And then antibiotic resistance. We talked about that already. These are some of the most common players in biofilm production. Now I'm going to try to pick it up a little bit here because I'm starting to run out of time and I don't want to miss anything. So biofilms, excuse me one second. One of the problems with biofilms is that they're very, very sticky. They are so sticky, they're actually used at biohazardous waste sites for remediation. So they do this through sorption, particularly heavy metals, hydrocarbons, industrial waste, and wastewater treatment. This is important because if you have biofilms growing in your body, every heavy metal that passes it, every persistent organic pollutant that passes it has the potential to be bound and held by these biofilms. And it also makes it an obstacle to achieving true detoxification if you don't address it. Glycoconjugates have diverse structures such as glycoproteins, glycopeptides, peptidoglycans, glycolipids, lipopolysaccharides, and glycosides. That's a lot of big words, but really all that what I want you to take away from this is that lipopolysaccharides, that pro-inflammatory mediator, is actually used to produce the biofilms. So just remembering that as you break down biofilms, that LPS and other endogenously produced toxins will also be released and potentially causing inflammation and difficulty in the body. Uncomfortable reaction is what it feels like. It can be a flare in what's already happening. It can be completely different from the typical experience that the patient is having. So sources of toxicity from biofilms. Lipopolysaccharides and other metabolites are produced continually by these microorganisms, and our immune system can't get at them, right? Chronic inflammatory damage because of that, and damage to the hepatocytes again, so the liver function. Retention of toxins in the extracellular matrix, so heavy metals, organophosphates. Retention of endogenously produced toxins, so oxalates and LPS and TMAO. So there are many different metabolites that are produced by the microorganisms and our own body functions that are housed in those biofilms as well. And again, it's an ongoing source of dysbiotic organisms. That's important because if you don't clear biofilms and you're working on clearing a chronic infection, the biofilm will just reseed the infection after the antimicrobial or antibiotic goes away. And we do see this as clinicians. We'll start to see someone who feels better when they're on an antibiotic, and then 2 or 3 months later, their infection returns. That's a hallmark for someone who is seeding an infection with a biofilm community. So really important not to miss this in the patients. So let's switch to talking specifically about oral health and biofilms. You heard me talk about Candida on the teeth, right? So the reason I picked Candida on the teeth is because I think the easiest biofilm to identify for us is fuzzy teeth at the end of the day. That's a biofilm, and Candida albicans is one of the main players in the production of oral biofilms along with Streptococcus mutans. This is what a biofilm on a toothbrush bristle looks like. And so this is one, let's see, I need my pointer here. This is one toothbrush bristle, and this is the same toothbrush bristle at higher magnification. So we did talk about already that the teeth and also dental implants and prosthetic joints as well, because they are non-shedding surfaces, are more likely or at higher risk for the development of biofilms. And the oral microbiome has the same thing happen that happens in the gastrointestinal tract, meaning, and actually I didn't even talk about this, so let me just say quickly, when we have dysbiosis or gram-negative bacteria, overgrowth of bacteria in the gut, the increase in the production of lipopolysaccharides, that's very inflammatory, even to the mucosa in the gastrointestinal tract. It irritates the gastrointestinal tract and it can cause leaky gut. The same thing can happen in the mouth. So if we have biofilms, oral biofilms by gram-negative bacteria, and they're increasing the release of lipopolysaccharides, that can cause sort of downstream effect. And let's talk briefly about what that looks like. So here you can see a few little cells, microorganisms. This is pretty normal, right? So this is normal level, but when we brush and floss, right, and keep our teeth clean, when we eat a healthy diet, then the ability for those microorganisms to get down inside the gingival tissue is a little bit harder. And of course, that's not always the case. Sometimes people with perfect oral hygiene still get development of gingivitis and periodontal disease as well. At any rate, when those microorganisms get here between the tooth and the gum, where we can't reach it mechanically, what happens is that our immune system comes in and it starts to try to take care of it. But when it's a biofilm, it has no effect. And instead we see collateral damage similar to what we talked about in the liver. And that collateral damage causes inflammation to the tissue in the area. The bloodstream is so close, the adjacent tissue there, that we get direct inoculation of bacteria into the bloodstream right from the tooth, from the periodontal pocket. We also get translocation of metabolites. So again, that lipopolysaccharides, peptidoglycans can transfer directly from the periodontal pocket into the blood flow. And we know that it contributes to systemic diseases. You can see here, ultimately, you can end up with deep periodontal pockets, loss of alveolar bone, and the destruction of the periodontal ligament as well. So what's the outcome? I'm going to come back to this slide and go forward one. So less than a minute after oral procedure, organisms from the infected site may have reached the heart, lungs, and peripheral capillary system. Also, it can cause damage to the blood-brain barrier. And we know now that pathogens in the mouth are linked to things like Alzheimer's, dementia, and to other neurological conditions, and also to mood issues. So anxiety, depression, other mental health issues as well. People with untreated tooth infections are 2.7 times more likely to have cardiovascular problems, such as coronary artery disease, than people who have had treatment of dental infections. So pretty profound. And even the levels of LPS, if you think about it in this way, where we have direct access to the bloodstream from the mouth, at least when you have damage to the lining of the mucosa in the gastrointestinal tract, the liver will remove most of the LPS. But when it's in the mouth, you're dumping those or releasing the lipopolysaccharides and other metabolites directly into the bloodstream, where they can flow into and damage the blood-brain barrier and flow into the brain, flow up throughout the systemic tissue. And even modest increases in LPS will dramatically increase metabolic disorder, weight gain, and cardiovascular disease risk. So it's really, really important. 77% of American adults over 65 years of age have some degree of either gingival or periodontal disease. Periodontitis is the most common, globally, is the most common infectious illness in adults. And globally, 50% of the world population has some degree of periodontal disease. This is important for us, right? As practitioners and for our own self-care, this is an easy place for us to apply a therapeutic. So when you're thinking about supporting detoxification, supporting systemic health through the microbiome, the mouth is a good place to start. And it is why Dr. Fresco developed the Biocidin for this particular purpose. Not to be forgotten is the microbiome. So we have microbiome includes all the different microorganisms. The microbiome is specific for fungal organisms. And just to bring this in as a piece of awareness also, oftentimes patients with SIBO are treated with rifaximin or another antibiotic, and it does remove the competition for fungal elements. And so it's really important knowing this, that you have some antifungal support as well. The microbiome is, we think of Candida, and these two microorganisms that were looked at in this particular research were Candida and Aspergillus. And you can see here an increase in inflammatory mediators, right? So inflammation, for the purposes of our discussion, are really the underlying cause of an increase in toxicity and toxic load, toxic burden for the body to clear. So here we see an article talking about the microbiome and the gut-brain axis. And what they're talking about is that the microbiome participates in modulating cytokines, so inflammation, production of inflammation, Candida albicans, Aspergillus, through interleukin-6, which is a pro-inflammatory mediator, and that the immune pathways play a critical role here and are mediated by, again, by cytokines at the gut site. So really important piece here, or just another piece of evidence indicating that what's happening in the gut in terms of fungal overgrowth could be contributing to systemic inflammation. And this is a picture of Candida and a Candida biofilm, and it does not take long. So 24 hours, actually, I'll just ask you to all think about, if you get up in the morning, you brush your teeth, especially on days where you're maybe eating a high carb load, your diet's not as healthy, your teeth are going to be fuzzy by the end of the day. That's a biofilm, and that's how quickly they form, and why it can be so helpful to have an anti-biofilm therapeutic on board. So let's talk about the solutions that Dr. Fresco has given to us as a group, right? So this is, I love this the book Clinical Botanical Medicine. It's by Dr. Yarnell, Kathy Abaskal, and Dr. Robert Roundtree. And they put so beautifully, I'm going to just read this and then sort of give you my interpretation or why it feels relevant to me. Historically, combinations of herbs, usually referred to as formulae, in some cases combining as many as 20 to 30 herbs, were commonly employed. This exponentially increases the range of possible interactions between constituents in the various herbs themselves, as well as the human body. We have empirical knowledge of plants based on millennia of use, so they've been around for thousands of years. Plants often have a positive synergistic effect on medicines such as antibiotics and chemotherapeutic agents. The complexity of botanical medicine is ultimately a delight. It is not merely a frustrating obstacle in the way of solidly designed, double-blind, randomized, placebo-controlled studies. The full benefit of botanical medicine will be ours only if we're willing to rise to the intellectual challenge that plant use presents. So there are a couple of really, to me, very beautiful things that are said in this paragraph, and I did take some of it out. I pulled out the things that felt the most relevant for our conversation to me. The first is the synergy that they talk about here. So synergy, how I think about synergy is that when you're making a formula, 1 + 1 does not equal 2. It has a sort of a, I'm sure synergistic is the right word, but it's like exponential in a way, right? So I will think about it in this way. If you have an antimicrobial herb, but you don't include a biofilm breaking herb, then you can only go so far. But when you include a biofilm breaking herb in a formula with an antimicrobial herb, the therapeutic effect is significantly greater. The same thing is true when they talk here about the use of pharmaceuticals along with botanicals. So there's a great example, again, with biofilms. Biofilms are very high in something called an efflux pump. There are lots of efflux pumps in biofilm communities. And the efflux pump protects microorganisms. It basically pushes out anything that the microorganism sees as damaging. So this is one of the mechanisms of antibiotic resistance. Botanicals can break down or disable those efflux pumps. So now what you have when we're talking about Biocidin, which I'll get into shortly here, is a formula that has antimicrobial herbs. It breaks down efflux pumps, and it has breaks down biofilms. So you can imagine that the efficacy is significantly different than a single herb might be. And the other piece that I love about this is that it's unapologetic and in a way a call to action, I think, to all of us as clinicians and as people who are seeking natural health, not to be ashamed because we don't necessarily have all of the same data made in the same way that is presented traditionally in the conventional medical model. Not to say that those are bad. I always think it's like icing on the cake when we have a great study. But the reality is that these formula have been used for thousands of years with great efficacy, and we're really not doing ourselves a favor and doing a disservice to our patients if we ignore those activities just because it doesn't fit a certain paradigm. So I'll get off my soapbox now, but it's so important to me. And I also really just feel as though those plants are here as a gift to us. No matter how you feel about evolution or creation, our bodies are designed to interact with them. And I'm so grateful for the opportunity to work with them. So one way that botanicals can support a healthy microbiome is through the support of the enzymatic conversion of prebiotics into the short chain fatty acids, right? And so herbal medicines, they're an important resource provider for short chain fatty acids. So it's what you eat, but it's also this enzymatic function and remembering the importance of those short chain fatty acids and keeping those levels nice and high. An example would be shiitake mushrooms have a prebiotic effect by stimulating the enzymes that are responsible for this conversion. So what is Biocidin? Biocidin is a tincture. It's a glycerite tincture. I always describe the taste as sweet pizza. I think the oregano and the garlic really come out, but it's sweet. So it's not unpleasant at all. In fact, lots of people like the taste of it. It was developed over 30 years ago by Dr. Rachel Fresco in response to practitioners in the Bay Area who were looking for a botanical or a natural way to support HIV patients in keeping their pathogen load at bay. So that was the initial development. At that time, one of the head of Great Smokies Diagnostics, which is now Genova Diagnostics, called up Rachel and said, "What is in this product? It's killing everything we put it against." And she said, "Is that a good thing?" And he said, "Yes, it's a good thing. And we'd like to put it on our comprehensive digestive stool analysis test for sensitivity against microorganisms. And at that time, it was the most effective antimicrobial that they tested on over 250,000 stool samples, which is why we're really renowned as a gut health company, because that's where we got our start. But you can see his quote here: Biocidin has been the most broadly acting and powerful agent evaluated, and that included many, many different agents. So what are the activities of Biocidin? There are a number that we have either proven research proven through research, or that have been proven on the ingredients that are in Biocidin. The first is broad spectrum antimicrobial, and selectively, so it doesn't kill all the good guys too, selectively, and we'll show you that pilot research shortly. Supports simultaneous clearance of multiple classes of harmful organisms. So then we're talking bacteria, yeast, fungal, viral, all of those things potentially. Again, not a claim by the company on across the board, but we know that in many of the ingredients in Biocidin exhibit this effect, and we did see this on that the 250,000 sample with Dr. Lee as well. Disrupts and dismantles biofilms. So we have a pilot research showing disruption of biofilms, and we also have published research showing the disruption of the Borrelia biofilm. Clinical research shows immunomodulatory activity. So we have a human clinical trial showing an upregulation of immune function within an hour of using the throat spray, and then addressing inflammation through multiple activities. So the way that I think about this is, one, the reduction in lipopolysaccharides and inflammation caused by inflammatory mediators. And then also the herbs that are in this, or the botanicals, have a very potent anti-inflammatory effect in the body, just in their own right. We also have a liposomal biocidin. A liposome is a form of technology that allows the direct transmission of a medicine or whatever is inside of the liposome from the mouth into the bloodstream. So it bypasses that liver, which means that you're going to get more of it systemic. So and we actually were able to show 74% better intracellular absorption in the research that we did out of Finland. And this is important if you're looking for activity of the Biocidin outside of the gastrointestinal tract. GI detox is our binder. So I did talk some about biofilms and microorganisms when they're dying off, and when you're breaking open biofilms, and you're sort of creating a swamp of pro-inflammatory and toxic molecules in the body. It can feel really awful. This is known as a Herxheimer response, or when I was in medical school, it was called the healing response. I now understand that it's not healthy, right? So if someone starts to react poorly to the Biocidin, bringing in the GI detox is of vital importance, and this needs to be taken at least an hour away from everything else. But this, like the Biocidin, is a formula so that it's broader acting. So it has activated charcoal, zeolite clay. It has silica, which is a living silica. It's the highest quality silica available on the market right now. It also has apopectin, humic and fulvic acids, and aloe. Sometimes people have the reaction of constipation from the GI detox. Most people are just fine with it, but the aloe does help to mitigate that somewhat as well. So this is really great. It's basically a sponge. So you want to do the activity of breaking down biofilms and have the antimicrobial effect, and then you come in with the sponge basically to mop up the damage. And the way that I would always write it on my treatment plan was, this one might make you feel bad, right? And this one will make you feel better. So the GI detox, really excellent for any kind of exposure that you want to limit. Then taking some of the GI detox can soak that up. So here, let's go a little bit into our research and case studies. My time with you is limited, but I'm going to try to get it in. This is really exciting for us as a team to have this research. And it's really great as a scientist myself to work for a company that's willing to put money back science-backed research into our outcomes, understanding why do we see the clinical outcomes that we do. So this is biofilm research. This was done in 2013 at the University of Binghamton. And on the top, you can see Pseudomonas. This is E. coli. Here's the control, right? So these are microorganisms, both planktonic, so free floating, and biofilm communities who were not treated, stayed level. And here too. This is the Biocidin liquid. or no, excuse me, both of these were Biocidin liquid tested. And one is biofilm and one is planktonic. And you can see almost an immediate killing effect with Pseudomonas. And then it took time, but over 24 hours, a total dismantling of the biofilms. This research was also done on Klebsiella and Candida. And here's the Candida, some slides from the Candida. Here you can see a Candida biofilm dismantled fully within 1 hour and unable to reestablish itself after 24 hours. So the question we get most often is, what about the good guys? So I hear you talking about pathogens, what happens to the beneficial microorganisms. So in doing our due diligence, we did pilot research with Sun Genomics, who does whole genome sequencing. And what you're seeing here is time point 1 and time point 2, here and here, time point 1 and time point 2. And what we pulled out, this is one person and just 4 really well-known microorganisms and their before and after. So a couple of outcomes from this research. The first is that there was no decrease in beneficial microorganisms, probiotic abundance of beneficial microorganisms. In fact, many of them increased. So this is what it showed: 69% of the participants had an increase in probiotic abundance. 73% of those people had an increase in Akkermansia. Akkermansia is a keystone species. It's a placeholder for other beneficial microorganisms to establish themselves and reproduce, and it's linked to things like weight loss and healthy blood sugar, metabolic syndrome, benefit to people with metabolic syndrome. So, and metagenomic richness, which means, again, all of the different microorganisms that are growing in the gastrointestinal tract. So here you can see time point 1, time point 2. And basically what we're seeing is not a big shift, but none went down. None of the beneficial microorganisms went down. And the total abundance is here. And you can see across the board that we had either a very, very, very small decrease, but for the most part, the vast majority of the people, it was an increase. This research was done by Dr. John Rothschild. He's a dentist in Colorado, and he had 9 participants in pilot research, and he was using phase contrast microscopy to identify elevated pathogenic microorganisms like gram-negative rods and spirochetes in what's called gingival crevicular fluid, which means that they pulled fluid out from the periodontal pocket, put it on a slide, and then were able to isolate or identify pathogens in that fluid. He then sent the patients home with the liposomal biocidin, so that Biocidin LSF, and they were told to swish and spit twice a day for 1 month. And when they came back, 7 out of the 9 participants had a reduction of or elimination of those pathogens. And this is what initiated the production of our dental line. So here's that in a picture. You can see here biofilms and pathogens before, and then 1 month or after 4 weeks of use of the Biocidin LSF. So here's the outcome of that research: was the production of our toothpaste. The toothpaste is 20% Biocidin liquid, and it has zeodent, which is silica, assisting in gentle cleansing, and it has a natural toothpaste base, including some other like aloe and some other lovely nutrient support to help with fresh breath and clean mouth. So freshens breath, tastes great. It's easy therapeutic. All of us are already brushing our teeth. And so this is an easy place to start with, affecting the microbiome in the mouth. And then as a result of that, everything that's in your mouth, just as a point of awareness, in a milliliter of saliva, there are 10 to the 8th microorganisms. We swallow a liter of saliva every day. So it's kind of important. We can get translocation. There's actually research showing that people who brush their teeth more often have lower levels of candida in their gastrointestinal tract. In addition to the toothpaste, we also have this the dentalcidin LS, which is the liposomal form of the Biocidin, in addition to CoQ10 and quercetin, to help with some additional support for the oral mucosa and breath as well. So if you're looking for a deeper therapeutic effect, so periodontal pockets, cavitations, root canals, that sort of thing, then the dentalcidin LS as an oral rinse, it would be the ticket. In addition to, it can be used in combination with the toothpaste as well. So this is preliminary clinical trial data. And what you can see, so these patients are patients that were positive for SIBO, and we're showing before and after testing and what's called an intestinal barrier assessment. This is through precision point diagnostics. And you can see here, before we have zonulin, which, well, let's talk specifically about the red since I'm running out of time, but here we see diamine oxidase and histamine and the ratio of those two to one another, really in the red zone, right? So way off. Diamine oxidase is produced by the brush border of the gut, and it's an enzyme that's responsible for the breakdown of histamine. So if you have patients or if you have histamine intolerance, meaning that high histamine foods irritate you, they can cause nausea, diarrhea, gas, bloating, irritability, insomnia. All of these things can be a result of elevations in histamine, and that can happen as a result of damage to the lining of the gut and a reduction in the production of diamine oxidase. And you can see here that this person had, it looks to be exactly that scenario going on, right? So low diamine oxidase, high histamine. And here you can see 5 weeks later, is that right? 6 weeks, not quite 6 weeks later, we can see on just the Biocidin liquid and the GI detox, we can see a reduction or an increase, excuse me, in the diamine oxidase and histamine going way down into the normal range. In addition to that, we looked at the LPS antibodies. So LPS antibodies shift more quickly, and they're a better way to determine the total LPS load in the body. And you can see here that LPS, to start out, was very, very high, but in all different antibodies that were looked at. So IgA, IgG, and IgM. And here you can see dropping into the normal range, this one actually below normal, IgA. So really exciting for us to have this information. Also, very exciting research. This was done by Dr. Pam Hyde, and she used the NeuroRead. She was working with dementia patients, and you can see that this patient, this is basically a picture of brain inflammation beforehand. Then after using the detox kit, so the BioClear cleansing kit, which is Biocidin liquid or LSF, depending on what you're trying to reach, and the ProFlora, which is our probiotic containing spores and some nutrients to heal the gut, and the GI detox, that binder, you can see that she was able to clear most of her brain inflammation, and she did have some improvement. And most importantly, she didn't progress in her dementia symptoms as well. So this is a very cool case study for us. We're hoping to write this up. So 7 steps as a general clinical approach to detoxification. I'm sure you're going to hear plenty of this during the summit, but let's do a quick review. So making sure that you get a detailed environmental history if you're the practitioner, or if you are listening as a patient or as a consumer, then knowing your own environmental history and potential exposure and learning about what that could be and what it means. Detailed history of gastrointestinal health, including the use of medications that disrupt the microbiome. Specific toxicology testing, so getting tested if you feel you may have a high toxic load, getting stool testing, or you can look at the LPS antibodies if you want to evaluate the toxicity that's being contributed by the microbiome. Remediation of abnormal biochemistry as identified by laboratory investigation, so micronutrient testing or organic acid testing. All of these things can help us to evaluate metabolic functions that are out of balance. Regular sweating with mineral repletion, so making sure that you're continuing to get electrolytes and minerals when you sweat. You can either do that through exercise or in a sauna, or ideally both, and it can facilitate then what's called transdermal excretion, or the release of toxins through the skin. Daily exercise will help move lymph and will help move toxins out of the body as well. Directed therapies for retaining toxicants may be implemented. Excuse me, not retaining, but for retained. Which I think in this particular case, what we're talking about are things like DMSA and EDTA, and these are things that need to be prescribed, or even IV vitamin C, IV glutathione, things that need to be prescribed by a practitioner. Last but not least is a combination of optimal diet and supplemental nutrients utilized to secure adequate nutrition. So glutathione, B vitamins, including folate, alpha lipoic acid, adequate minerals, very, very important. Chlorella is a nice, gentle detoxification support for decreasing absorption and enhanced excretion of toxins. And finally, fiber, which works similarly to a binder and it also promotes the production of short-chain fatty acids. So these are pretty basic ways that you can start to support your body's ability to detox. Thanks so much. And I hope that all of you can take away the importance of managing the microbiome in order to help us decrease our toxic load. And I hope you all give it a try. It certainly in my clinical practice was a really dramatic experience for me when I introduced it to my own health, for my own sake and for my patients. And it's easy to use, low intervention, well tolerated. And I'm here because of what I saw happen and wanting to spread the word. So give it a shot and let us know how you do. Thanks so much.